was all happening at once in the early hours of today. Kenya has received 1.02 million doses of COVID-19 vaccines through the COVAX facility. In the words of the Kenyan Minister of Health, Mutahi Kagwe, the vaccines are equivalent to bazookas and machine guns. Also on Tuesday, March 2, there was a huge one for Nigeria as it received its first batch of COVID-19 vaccines through the COVAX facility. Now, Nigeria's Minister of State for Health, Dr. Mamora, was here yesterday with me on the program, and he enlightened Nigerians and Africans on the mechanisms being put in place by the government of Nigeria on equitable distribution of the vaccines. We've heard the government speak to the people. Now we want to hear from those who are on the battlefield, both home and abroad, on why they think Nigeria and Africa has fared well so far. Welcome to VSA. I'm Sulaiman. When COVID-19 hit Africa, the fear was palpable. Many experts feared it will be dead off, on the continent, having a lot of people being picked on the street on the continent, to the extent that the Guardian UK has also written on why Africa hasn't actually gotten into that dire strait. What is it Africa has been doing to ensuring that the continent is seem to be on course or taking care of its very own in a world of pandemic. As the disease raged on, the realities of the pandemic changed people's rhetoric. The source of the continent's safety or low cases became a subject of medical debate. While some have said the weather is the reason behind the low cases, others have said it's the continent's youthful population. So some others have even said poverty may be the reason Africans are not dying as expected from the disease. Well, within the continent, the feeling is not great as Africa crossed the 100,000 fatality mark with an average of 2.6% case fatality rate on the continent. The B1351 strain, or the South African variant, has killed many people, sadly, especially in South Africa where it originated from. The continent is not losing sleep, especially with vaccines now coming in as Ghana, Ivory Coast and Nigeria have all taken delivery of their first batch of vaccines. Joining me now on VSA, Dr. Fiona Atuhebe. She is the Regional New Vaccines Introduction Officer for World Health Organization, Regional Office for Africa, and Dr. Olugbenga Alabi, Clinical Fellow, Neurology and General Medicine, Southern Health and Social Care Trust in the United Kingdom. Lady and gentlemen, many thanks for finding time to be here on the program.
Thank you, Sulaiman. Thank you for having me. Good evening, Africans. Good evening, Nigerians.
Let me start with Fiona. Nigeria, Kenya, the Gambia, Rwanda, Senegal have taken delivery of the first batch of COVID-19 vaccines. What do you think should be done moving forward now, looking at the situations in these countries?
Thank you very much. I want to tell you that actually there are many more countries than that. Well, we have Angola too, and which has received vaccines. So we have around 8 countries as of today that have received the COVID-19 vaccines from the COVAX facility. And by the end of this week, we shall see 17 countries in total receive the vaccine from COVAX. Yes, so yesterday when we saw the arrival of 4 million doses of the AstraZeneca vaccine in Abuja, it was a very exciting moment for us to see Africa's economic powerhouse receive their first vaccines, and we are hoping to see 16 million doses total from the COVAX by the end of 2021 get into Nigeria, and all countries in the African region, part of the COVAX, receive vaccines to cover 20% of their populations. So seeing these vaccines start coming out is such a big thing for us. So we are aware that in Nigeria there will be a high-level launch on Friday. and with the announcement that will happen on the next steps. But the government has launched a robust vaccination strategy, that teach strategy that we've been told about, the traditional rollout, electronic registration, assisted registration, concomitant vaccination, and house-to-house registration approach, which will use online platforms. And this is something strong that we've seen that the country has put in. So as with any other vaccination campaign, the importance of proper planning and preparation is key and cannot be underestimated. So there are many steps to take before the vaccines go from the airport where we saw the pictures to the arm of the targeted recipient. And you need detailed micro-planning, logistics. We are planning to vaccinate populations that we don't normally vaccinate. Health workers may be easy to find, but when we get the elderly who were not used to vaccinating or to have programs for, people with comorbidities, people with hypertension and diabetes, where do we get them? A proper cold chain and all that needs to be in place. Of course, strong communication strategy to create demand and ensure that we fight this infodemic that has come with the COVID.
Well, Dr. Fiona, quite an extensive and an elaborate one it is for the continent. The good thing there is that experts like yourself, and talking about sensitization, that's the good reason why we're having both of you here. Now, Olugbenga, tell us now, listening to your colleague, Dr. Fiona, there are, some countries still on the waiting list of receiving their first consignment of the vaccine. Others have started with the rollout. Where does this put Africa in the fight against COVID-19?
Yeah, thank you, Sulaiman. Thank you, Fiona. I think receiving the vaccine, when I saw that in the news yesterday, I was very happy and glad. And that we are joining the Committee of Nations in fighting this pandemic together, and not just using the basic tool of social distancing, hand washing and the likes. But I think it's a good thing. And but it's just comparing the population and the amount we've received. I think Africa needs to wake up and do more. And this is a wake-up call for us to also, if possible, begin to plan to develop our own local vaccines, and so that we can also compete with the developed countries and the likes. So that's just my.
Let me quickly go back to Dr. Fiona, because we live in a continent where we're not any different from the rest of the world. There are Thomases, Fiona, a lot of them, and I'm quite sure you must have met a few of them who are skeptical about this vaccine you and I are excited about. Have you seen, from amongst your colleagues, such skeptics?
Yes, we have seen them, but we had, much as Africa delayed to begin vaccination for this COVID-19, and we made all the noise, the richer countries have started, Africa has not started. It bought us time. It bought us time, number one, for this issue that always comes up of Africans being used as guinea pigs. We managed to overcome that by the Western world having to vaccinate first. And then we also have the fact that there has been time, and health workers did see the disease firsthand, at least in most countries. But we also have health workers who are quite skeptical about the vaccine. And a lot of education is going on. The good thing with health workers, their IQ levels are really usually much, much higher than the average population. So they understand science. The issue is when they don't have the right information, and where are they getting the information? If their information is coming from social media with all these, the negative, the anti-vaxxer messages we see, it becomes difficult. But scientists know that when you want information about science, we get it from peer-reviewed journals or articles. We get it from the CDC, we get it from research articles. So all this has been done, and scientists, we keep communicating and communicating. At the end of the day, this time around, the health workers are both a patient, and we give them that right to be patients, recipients, vaccinees, but also the health worker. So the education to the health workers should be also as robust as we give to the rest of the communities.
Well, Fiona, let me stay with you before I go back to Lugbenga. Are there any countries that the WHO is prioritizing in receiving the vaccine, especially owing to funding constraints or the dire need of the vaccine? I mean, we've seen President Cyril Ramaphosa say there are some poor countries having some difficulty procuring the vaccines because some richer nations have actually procured almost the supplies.
So the WHO is supporting all African countries to receive the COVID-19 vaccines, regardless of how they procure them. Including we are doing the capacity assessments, the regulatory mechanisms, the cold chain capacity, and the training of health workers and all. But for the COVID vaccine rollout, given the global supply, the global shortage, right, the limited global shortage, this is the first time we have a global shortage of a vaccine even before we start vaccinating. So our current focus is on ensuring that we vaccinate the priority groups, given the epidemiology of the disease and who was affected the most, that is how we came up, for example, with health workers. So all 40 African countries in the WHO African region are eligible to receive vaccines at no cost whatsoever, free from the COVAX facility, to cover up to 20% of the populations. And that is the vaccine you received yesterday in Nigeria. All countries will receive vaccine up to 20% of their population, and that's what we are calling equity. Countries, the Gambia received just 96,000 doses. Nigeria received almost 4 million doses because of the population differences. So each country, by the end of March, we shall see every country start vaccinating without any prioritization of one country over the other.
Okay, Olugbenga, listening to Dr. Mamara, Nigeria's Minister of State for Health yesterday, reading out the modalities as well as the plans the country has put in place. Do you think there are things that you would want to, kick into that plan if there is something missing?
I think the government has tried its best in ensuring they give priority to certain set of people. And I think even in the developed countries, that is what has been done. They prioritize giving the healthcare workers, the elderly, those who are more than 80, and then those that have comorbidities. So those are more people at risk. And I think it's good they've done that. But the problem is just that how do we target this audience? Because you mentioned something about vaccine hesitancy. It's not only in Africa. Even in developed world, you see even doctors, healthcare workers trying to say they don't want to get vaccinated because of some of these conspiracy theories. And I think the rollout that the government has brought forward is a good one if we will execute them well. The only problem is getting the records. And I think I'm using Nigeria as an example now. We see that we've got some poor record keeping. And if we are planning to target elderly, people with comorbidities, you and I know that it becomes a difficult challenge. And Fiona raised that fact earlier when she said sometimes we have some difficult populations. And unfortunately, those difficult populations seems to be the first set of people we should vaccinate. So there is we need to ensure we have a balance in getting the vaccine, which is good, and targeting those we need to vaccinate. And that's something I'm watching to see how we will go about it. But I know I will always get around things and get it done because it's something that all happening.
Fiona, it's a tough one for the world. It's a tough one for, especially the WHO as well, knowing full well that first, on the one hand, you're trying to get these vaccines across the world. On the other hand, you have people who are, spewing, some conspiracy theories, making it difficult for people, especially worst case scenario, people who have some underlying illness not to even present themselves to be so vaccinated. Let's speak more about such sensitization and enlightenment? Because this is very important. Otherwise, the vaccines might just be on the shelf without people presenting themselves to be so vaccinated.
You're very right. You're very right. There's a difference between vaccines being in the country and vaccines actually getting to people who do need them. Earlier today, we had this webinar across the continent for ministries of health and different people in public health to learn from countries that have started vaccinating. Because we have 12 countries in total in Africa that have started vaccinating already, starting in January when Mauritius and Seychelles and Algeria and the like started vaccinating. So we had lessons from them. We even drew lessons from as far as India and Indonesia. So these countries, the smaller countries are lucky that it is easier to have their populations mapped out and know they have their clinics for these chronic diseases and can easily follow these people. But for these large countries like Nigeria with huge populations and a system that does not put in place, that cannot trace these people, it becomes much more difficult. So I've seen some countries just make a decision to go for just older people. And then when they find people with comorbidities, then they can go for them. But every country did write a national deployment and vaccination plan. And Nigeria did write a robust plan, a very good plan that is quite outstanding on how to get to these populations. So the fact that they decide, they put in place a plan on getting these people, and there's not even just getting the people themselves. When you get them for the first dose, we are giving a second dose 8 to 12 weeks later. This is 2 to 3 months later. We could easily lose them to follow up. You don't know where they go. If we can lose young babies to follow up, part of adults who travel around the place and have these decisions that they make that they don't want a second dose or they're just too busy for it. So these plans that have been put in place should be able to help us, and if followed to the dot. Nigeria is very good with vaccination. You've had enough polio campaigns, and we are confident this will work.
Olugbenga, listening to Fiona, what readily comes to mind is, of people who have also suffered, maybe in times past, some, bad vaccination management. For instance, you recall the incident that happened in the polio vaccination experiment in Kano. People are already asking questions. Why shouldn't we believe or look towards those spewing, these theories if we had a bad experience in the past?
Yeah, I quite agree that we can have some bad experiences about vaccination, and even we see that, and that's why usually before you get vaccinated, they ask some questions, and I know that in developed worlds now currently, and I'm sure Nigeria also want to follow suit, they ask that people who have allergies should not get vaccinated now, or who has had previous history of allergy should not get vaccinated. So that's one. Then other thing is that even in the composition of the vaccine, aside the active ingredient, there are also some other constituents of the vaccine. Though I'm sure the Nigerian government will roll out the plan to ensure that whoever has had a reaction to any of the content of the vaccine should not get vaccinated for now, pending when we conclude studies to be sure they are free to get vaccinated or not. That's true. And I think trying to ensure that people get vaccinated also boils down to sensitization of the public about why we should get vaccinated. You and I know that getting vaccinated would reduce the severity of COVID infection if one probably gets COVID. And it's something we have all agreed. Meta-analysis of studies of vaccines that have been rolled out have shown, even in the UK, that there has been reduction in the severity of presentation of patients with COVID-19 following the rollout of vaccination. But we need to just ensure we do enough sensitization. Probably the National Orientation Agency will have to wake up from its call and then take it off to ensure they inform Africans, inform Nigerians about this vaccination, and also on the part of the I think it's the National Public Health, the National Primary Healthcare Board that will be managing the vaccine protocol. They need to inform people that, okay, whoever has had this, whoever has had allergy to either has allergy, has any reaction to any of the content of the vaccine should stay off vaccination for now, pending when we are able to get over and then know what to do. I think that's quite important for the government. Aside rolling out the vaccination, we need to tell people that there may be so reaction, but if you're able to get this done, you won't come down with it. I remember that when I got vaccinated, by the time you get vaccinated, you'll be made to sit down in the vaccine room for about 15 minutes, where you'll be observed, and then you'll be asked if there are changes and if you're feeling anyhow, because it's been observed that within the immediate change time when you get vaccinated, some people may immediately have an anaphylactic reaction to that. So to curb that, they ensure that they have you around within the first 15-20 minutes. And the day I had it, immediately I got the vaccine. After 15 minutes, I went back to work and I'm fine to date. So we need to ensure that we tell people that the vaccine is safe. But however, whoever has history of allergy or reacts to any of the components of the vaccine should stay off the vaccination for now. Thank you.
Well, I think we should say congratulations to you, Dr. Olugbenga, knowing full well. I think people like you should speak more. You know, Dr. Fiona, this is your baby, so to speak, because you are the new vaccine introduction officer, regional officer. And the continent is behind you to ensuring that this is an easier task because it concerns everyone. Take us through some of those sensitization steps you have already started around the region.
Thanks again. Yeah, first of all, having people like my fellow panelists come out there and talk about their experience is one of those steps that we are taking. But then if you realize the countries that have started vaccinating, the head of state is vaccinated first, and the first lady in most cases, also top politicians. This is not just by mistake. This is not the usual this usual of politicians are going fast and things like that. No, it is a deliberate step by countries to build confidence in the populations that this vaccine is actually safe, and it is safe, and here I am, because the president, yesterday on Monday we saw the president of Ghana being vaccinated. We saw the first president be vaccinated was the president of Seychelles. We saw President Ramaphosa being vaccinated also on TV. So really that building that trust among people. But also we've really tried to educate people as much as we can. The media, and I want to thank you very much, has really been out there with us. I have these talk shows practically almost all the time because we want to give people the right information. WHO in particular has these 5 minutes every day. Is 5 minutes in science where we break down the science to the most basic things. We've put out, we have a weekly press conference at the regional office in WHO every Thursday, 11 a.m. We have a weekly press conference where journalists are there and ask their questions because we want them to report the right things. We've held the webinars with health workers, with community health workers, with heads of state, with ministers of health, with public health specialists. We are really trying to communicate as much as we can virtually now that we can't be everywhere with the microphone singing all over the place. But we hope, and we've seen really less resistance than it is with other vaccines, because we are seeing from countries which have started vaccinating, we've seen very high levels of acceptance. We also did carry out studies before the vaccines start arriving in countries, asking one question: would you take the vaccine if it was made available? And we had, in most countries, over 80% of people saying, yes, I would take the vaccine. Then we have, among the 20%, the hesitant ones, they say, if I get more information, I'll take the vaccine. Then we have just about 4% say, no, I'll not take the vaccine. But we know from past experience, even those who say no, behind there, they will go and take the vaccine because they know it's good for their lives.
Well, I think it looks like the percentage of the Thomases, is thinning out, going by what Fiona has told us. Olugbenga, though you are in the UK at the moment, you are a Nigerian, and there are things that are peculiar to the Nigerian people, especially when it comes to doubts. Listening to Fiona, she's been able to put in place, the perspective why the leaders are doing this in the open to ensure that doubts are eroded. What are those things you think the people should know at the moment, knowing full well that now I want you to address the Thomases. You have taken this vaccine, and after 15 minutes you went back to your duty, to your job, and here you are again. Let us in on how it feels like. Were you apprehensive before that first jab? Did you think you were like a guinea pig? This is a personal question, so to speak.
Yeah, basically, I think one of the things the UK government did was that to target the hospitals, they do what they call vaccine mop-up for each hospital. So in my trust, I got the email, I think maybe getting it on Monday, that they will be coming to my hospital to do the vaccine mop-up. And I was like, oh, this is fine. I don't even need to travel 40, 50 minutes to get to the other hospital. So I just put in my application that I need to get the vaccine. It's true, coming from Nigeria, when I was to have the vaccine, they take your data and the like. Then I got to the point of where I would get the injection. The nurse that wanted to vaccinate me felt, am I scared? I said no. So I just felt, there's something I did that day that was quite funny. I thought of, I'm a right-handed person, and she said, where do I want it vaccinated? I was just like,
the left.
Let's assume this is to cause maybe paralysis. Give it to the left.
Just in case.
You got it right. So, and immediately I had it, I was like, okay, so it's in me, and I got my card, and then the second, my second dose is, I think, in April to get the second. So she gave me the appointment. I was like, ask me to sit somewhere. So is anything happening to me? No. Did I go a tail? No. Any vision problem? No. In fact, the next day I went mountain climbing and took so many pictures of places in the UK to see the scenery and the like. So there's really nothing that could happen. However, it's just that the trust that the government have not been able to get from the citizenry is one of the things that is causing this problem. Fiona raised a very important fact. If we ensure that our leaders are the first to get vaccinated, this increases the acceptability of the vaccine. Let me give you an instance. Though I'm in the UK, but I still listen to Nigerian news every day. Someone called in on a radio program and said that he is not even sure the vaccine he will take is what Buhari will take. And I was just laughing that, no, the batch of the...
Those are the kings of the doubters, the Thomases. And those are the people Fiona is speaking to today on the continent to do away with all of that. When we come back, we'll allow Fiona to take us through some of these, especially now that people are still talking about the second wave. It will seem as if some have downplayed the seriousness of the virus around. And again, we'll also look to those people who have allergies and how some of them can approach their doctors to say, I have A, B, C as allergy before presenting themselves to be so vaccinated. That will be when we return. Join us again. Welcome back. You know, the South African government has warned its citizens about a third wave of the disease, especially after the Easter celebrations. Nigeria is one of the countries of the world where celebrations are done in feasts with large groups of people. These are potential super spreaders, even in Lagos, Nigeria's economic capital. Some are clubbers, party goers. Over the weekend, were arrested in 9 clubs. Although the South African variant of the virus is not seen in Nigeria as of now, the government has said it will block the highly infectious strain in every way possible. So when asked about the AstraZeneca vaccine and the fuss it's generating in Africa, Nigeria's Minister of State for Health, Dr. Mamora, said it will be administered because Nigeria is yet to find the strain here. South Africa, after rejecting AstraZeneca vaccines, has gone for the Johnson & Johnson and Pfizer vaccines with combined 31 million doses of both vaccines expected in the coming months now. Let's start off with Fiona, who is helping us make sense of the goodies, because that is what the continent has already, especially trying hard to make some see it as that. You know, talking about allergies, which we highlighted before we went on the break, how can some of these people on the continent know that they have allergies? Because if you live in some remote, villages, say, on the continent, it will be very difficult for an African to know that he or she suffers from some allergies. Fiona?
Yeah, you're very right. But you see, every time we go to hospital, ideally, when a doctor is prescribing a drug or anything that you're going to take, the doctor asks, do you have any allergies? Or even before you get to the doctor, when they're taking your history, the nurses are filling in the form before they take your temperature. We ask for allergies. That is allergies now to anything, because people generally may not know the content of the vaccine. And we are saying that people who have a past history of allergies, could it be to plants, to pollen, to whatever, if you have had a history of allergies or the anaphylaxis like Dr. Benga was talking about, you've taken a drug and you've reacted to it, we are saying please wait, because we do not want to have issues. So anyone who has had allergies, you have a history of allergies, you've eaten eggs and gotten pollen, you have a history of allergies in your life, we are saying please wait. And that history will be very seriously taken before anyone receives the vaccine. It's not like any other vaccination. It's not polio where children are lined up and we do the drops. History will be taken, a consent form will be filled and all that. So for some countries, and allergies are part of that history that we are taking. If a person in a rural health facility or rural village somewhere does not know, they'll be explained to, when we talk of allergies, this is what we mean. And I'm really hoping that the health workers will be able to do this.
And Dr. Benga, you want to weigh in on that? How can this help, especially people here in Nigeria?
Yeah, I agree with Dr. Fiona that normally when in the course of taking history, you get to a point where you have for history of allergies, and it's expected that patients give you information either to medications or even to food. However, because of our poor health records, and this is why it's quite important for us to strengthen our health record system. The health information system needs to be strengthened such that even if the patient cannot give you that information, you definitely have it seen on the ECR. Because here in the UK, once you give me your name and maybe I know your H&C number, I can just put it into the system, and then I have all information about you, including the allergies you reacted to and the like. So, and in addition to that, I'll get to ask if you react to any medication. So if this is done, we will at least ensure we fight that. However, I feel that in addition to vaccine, it's quite important that our vaccination centers should also have mechanism put in place to ensure that they respond to patients or individuals who are vaccinated and possibly have an adverse reaction to that. I think we should also factor that into our vaccination during this vaccination drive, so that we won't have inadvertent morbidity or mortality from the vaccination. Because Africans, some may give you the information already that, okay, doctor, I react to maybe penicillin or Septrin or chloroquine, and some may not readily give you that. However, when they go ahead and vaccinate, and probably an adverse reaction happens, for us to ensure that we don't have mortality or morbidity, we need to also put in place the response to all this and teach our vaccinators how to respond to patients who inadvertently react to the allergy. Because you and I know that allergies can be mild, moderate, or severe, depending on the response of the patient. So if it is something mild, we know, okay, we can do this and do this. I've seen a patient get vaccinated and had what looks like a problem with movements. So in that case, but because the center is quite well established to cater for that, the patient got intervention early enough and everything came back fine. So in addition to asking the history and examination of the patient before being vaccinated, it's also important that we equip our vaccination centers the normal, at least baseline drugs to use if inadvertently a patient reacts to the medication. Because most likely most of our patients may only come down with mild reaction, and they can be solved with use of simple maybe antihistamines. It's just a very, very small percentage that may come down with something severe that may warrant maybe ICU admission, but I don't really expect that to happen. But the history of vaccination, as Dr. Fiona has said, is very, very important for us to take it. And for now, let them stay clear and avoid being vaccinated. Thank you.
Fiona, the worry for some is the South African strain, the B1351, and they've been asking questions if these vaccines that have been received would help to fight against that.
Yes, thank you for that question. So we know that, yes, in South Africa, they had this data that was from a small number of people that showed that the AstraZeneca vaccine had reduced efficacy in curbing mild to moderate COVID-19 disease. So, and this is what there was the basis of saying no to the AstraZeneca vaccine. They actually, if you are aware that the trend of the second wave was majorly seen in the Southern African region. When the new strain came and we saw that it actually seemed to spread much faster than the first wave that we had. So for vaccines, when we started this vaccine work, and the main aim of the vaccine has been vaccinate people in order to reduce the impact of severe disease and the mortality. We want to reduce severe disease and deaths. In short, we want to reduce hospitalizations and deaths and reduce the pressure on our health systems. Now, in the study that was done in South Africa, in those few people, the study did not collect data on if the AstraZeneca vaccine does do what we're asking it to do. Will it reduce the severity of disease and deaths? So that data was not collected. What was collected was the data on it has less impact on mild to moderate disease. But also South Africa has gone ahead to say they will study the impact of the vaccine on severe and disease, if it prevents severe disease and mortality. And this data will help us to make these other conclusions. However, the Strategic Advisory Group of Experts, which is an independent group of experts that do advise WHO, called the SAGE, Strategic Advisory Group of Experts on Immunization, reviewed all the data that came from the AstraZeneca studies, all the phases, phase 1, phase 2, phase 3 trials, and the data that came from South Africa, and said, let's still go ahead and vaccinate. We are trying to prevent severe disease and mortality.
Let me stay with Fiona before I come back to you, Lugbenga. Fiona, you know, experts like yourself, you've told the world the virus does not move. People move the virus. And we saw a surge in infection after Thanksgiving in the United States, after the Christmas festival and New Year. And now Easter beckons. Africans are a communal people. They party a lot. Is the virus going away for people to drop their guards?
I wish I had that question, which sounds like a prophet should be able to tell the answer. We know that even in South Africa, for the second wave, for the peak of the second wave, was when schools opened, the finalists, and they were asked to come in, and they just had these major, huge parties, 7 of them around the country, and we saw that wave from the super spreaders who were the young people that attended these events. So indeed, it's true that the people move the virus doesn't move. And now Easter is here. We have seen a downward trend in a number of countries, up to a 51% overall decrease of cases comparing to the last 1 month. But this trend is driven by some countries, not all countries, because we are still seeing some countries that are showing an upward trend of the cases. Now Easter is coming. The vaccine is here. We are saying before we reach the herd immunity, we are not relenting on our other prevention measures, because the vaccine will not take away the virus until everybody is immunized, until we have at least 60% of our population immunized. So we have to just continue masking up, we have to wash hands, we have to keep the social distancing, we have to just take care of our own health and take matters into our own hands. Otherwise, we could easily see another wave, because pandemics do come in waves. They actually go up and go down, go up and go down. So, and we are the spreaders, so we just have to make that decision on our individual lives and families and communities around us.
I'll come back to you, Fiona. Lugbenga, you know, listening to both of you, and of course, looking at the graphs so far from across the continent, how would you rate Africa's response to COVID-19 so far?
Yeah, that's a difficult question, and it's difficult because I'm looking at the economic power of the African continent, and compared to some other developed worlds, and the political will of our leaders also is quite important in the fight against COVID-19. And let me say this on a jokingly, that even here, if you are walking on the streets, there's lockdown, and the streets are quite free. You just observe that if you are walking and maybe someone is coming ahead of you without wearing mask, you just see that you just reflexively cross to the other side of the road, and just to ensure that you social distance. And I look at what happens in probably Oshodi in Lagos, and where we just clump together. So that's just by the side. But I think that the African continent have responded in the best way they felt they could, but there is always a room for improvement. That's one thing. And then the political will of our leaders is quite important. And the response we saw today from the developed world, it's not that they knew there will be COVID-19. It's just because they had prepared themselves well for eventually for unexpected things, and that's just the difference in the response, in the sense that they have a well-developed healthcare system that is ready to fight any disease and take care of their populace. Unlike Africans, in which we spend a very small percentage of our annual budget on health. I think in Nigeria, less than maybe 5% of our total budget is going to the health ministry. So this is quite small. And aside that, the motivation of the health worker should not only come in form of COVID-19 inducement allowance. It's the healthcare workers must see that the government is really keen in protecting them by the provision of personal protective equipment. Over here, you see that when you get to work, you don't just go straight into the clinical area to start work. You come in, there's an area we call the donning. So when you go to the don area, drop everything you have with you, your bags, your lunchbox and the like, and then you sanitize your hand, have to wash your face, get your face mask, the face visor, and then before you move in. And the degree of PPE you use is dependent on the level, the area where you work. They've mapped out each hospital into 3 zones. There's a green zone, there's the amber, there's the red. In the red zone, you have to go in with an N95, face mask, an apron, and the like. But let's say you work in the green zone, just go in with a face mask, visor, and then for every time you go in to see a patient, you have an apron, a disposable apron that you use. But all those things they may be expensive, and they are readily available within just 1 meter of where you are sitting to see the patient. So they are readily available, unlike not that you have ordinary surgical face mask being used and reused over time. Over here, you may use 10 face masks every day and nothing will happen. But maybe in Nigeria, we may not have that. And this is just because there is unavailability of enough PPE to fight this pandemic. Fiona raised something, and that's very important. The vaccine will not prevent COVID, but it will prevent the severity of COVID. So even if you have been vaccinated, you still ensure that for now, social distance, get enough PPE to work, and sanitize your hand, stay away from very crowded places, and all the non-pharmacological methods that we have been using, they work, they are still working, and they will continue to work even when you get vaccinated.
Let me bring in Fiona to close this for us. Fiona, listening to you, I'm tempted to ask if there are people who have already been identified as having immunity against COVID.
Well, after after people had gotten COVID, the sickness itself, we know that people do get antibodies. They do get protection and that what we call immunity against the disease. The difference is that it was found that in COVID, the time that this immunity lasts is a short time. For example, if it was measles and someone had measles as a child, we know that this offers them almost a lifetime immunity. We know that if you get a disease like chickenpox, you get this lifetime immunity. But now for COVID, we found that 6 months later, people have lost that immunity. And it has also been shown in South African studies that those who got the first COVID last year in the first peak, in the first wave, actually then that protection did not cover the variant. So things are quickly changing, but studies are being done, the sequencing is being done, and all that, and we call them seroprevalence studies to see in the community how many people did get COVID. Then we have studies to be able to tell how many still do have antibodies. And in some countries, actually, we got to learn that those who recently had COVID are not a priority now for vaccination, because we still believe that they are still harboring some immunity. Now that chance is ethically given to people who have not had the disease. So yes, there's some protection, but for a limited period of time, unlike most diseases that will give you a lifetime protection.
I think this is a fine place for us to say many thanks. It's been a productive discussion here about COVID-19. I must thank both of you Dr. Fiona and Olugbenga. Keep in mind that, go get the shots if you're watching at the moment. If it is available in your country, go all out there, get the shots. If it's time, stay safe, you've heard. And of course, keep the distance. Always remember, it's Africa first. Thanks for being a part of the show. See you again tomorrow.